Live. I'm GoLocal News editor Kate Nagel. I'd like to welcome my next guest, Representative Scott Slater. Thank you for joining us today.
Thank you, Kate. Thank you for having me on today.
Well, I wanted to have you on to give folks an update because you've been a strong proponent of marijuana legalization here in the state. And as we saw, there was a study commissioned this year to look at the issue, address the issue. As we know, we're in the waning days of the 2018 session. All eyes are on Massachusetts. Lessons are being learned from other states around the country. Let's start with the study commission. Where do things stand right now? What do you think's been learned? And then we'll talk about moving forward.
So, unfortunately, the study commission, they met, I believe, several times, and they've extended the date of the study commission into next year. So that's not a good sign because of the fact that I don't think we're going to have anything done this year on recreational cannabis, you know?
So with the commission being extended into next year, does next year look like it would be a reach for any potential findings and then legislation?
Yeah, so I really do feel good about next year. I mean, it's not good to always say next year, but I feel much stronger next year because of the fact that the pressure that's going to be put on our medical program because of the fact that you have recreational cannabis in Massachusetts and retail in Massachusetts is going to be up in July. And even the mayor of Attleboro has said kind of excited about the opportunities, the revenue that will be coming in. And you'll be seeing a lot of stores probably pop up along the border, which would have a negative effect, I believe, not only on our medical program, but, you know, we'd be losing a lot of tax revenue.
And so, the study commission was put in place, especially by leaders who said, let's take a prudent approach. Let's see other states that have legalized already. I mean, have there been lessons learned from Colorado, Washington, other states?
I think we've had lessons learned, and as you know, I've been supporting recreational cannabis for a number of years. I put this law in, it's probably like the fourth year, and I didn't participate so much in the study commission because I was kind of against it. I don't think we need to study it any further. I think we've studied the issue enough, and we could probably borrow Massachusetts' report and save ourselves time. So I'm in favor of moving forward. I think some of the changes you see that have been proposed in the budget this year with cultivators around the medical program, I think the reason for that is we have more than enough capacity to support a recreational program, and that's what we should have done from the beginning. So
Massachusetts going online in July.
Yeah.
The potential to look at it here in Rhode Island in 2019. I mean, ostensibly, how soon could something happen here if legislation were to be approved next year? Could we see it July 1st, 2019?
I think it could be early in the session.
Okay.
Just because we have the infrastructure here, and I've been saying this for a number of years. Through the medical program, before they made changes, we had caregivers, we had co-ops. Those since been kind of eliminated. Now we move to a system of cultivators. But all these folks, you have the supply. There's just no real place to distribute it.
And so what do you think is going to happen come July? I mean, no one has that sort of crystal ball, but a lot of Rhode Islanders who are proponents of legalized marijuana going over to Massachusetts. Are you really keeping a close eye on those tax dollars?
I am. I am. And I think you're going to see a lot of Rhode Islanders crossing the border and going into Massachusetts. And so Massachusetts is going to have a full recreational program. They also have, I think they're going to be putting up like cafes and other places where you can socially use. And I think it's really going to be a boon to Massachusetts economy. And it's something I've been pushing for here. Rhode Island, we can still do it, but we're going to lose some of that first mover effect, you know, some of the revenue and the testing facilities. And outside of just recreational use of marijuana, states that have legalization, they see a drop in opioid abuse. They see a drop in opioid deaths. And then it's just a safer alternative for folks. And there's so many other industries that are popping up around cannabis.
And so talk with us also a little bit about the legislation. Is there money earmarked to address if there are potential health issues that need to be looked at or studied or treated? Because that's what a lot of folks are saying. You're going to have folks going to Massachusetts, folks are already using already, but then the state isn't getting those tax resources to be able to put towards those programs.
So in my law last year that I put in for the recreational cannabis, about 40% of the revenue would have been going to substance abuse treatment, not just for marijuana, but for other substances. And I think that would have been a huge help moving people away from addiction and into recovery. So that revenue now will stay in the black market, or it'll be going across the border. And it's just a much safer system to have a recreational system, because it's tested, and you don't, and it's kept out of the hands of kids. Because as you see with cigarettes, people don't want to lose their license by selling to children and minors. So someone with a retail license is much more cautious than someone on the street. So.
Well, we're going to continue to keep an eye on what takes place in Massachusetts, and we're certainly going to keep an eye on what happens here at the Rhode Island State House in 2019. Representative Scott Slater, I appreciate your time. I understand that there is a picture being taken very shortly, all of the House of Representatives. So we're going to sign off here at the Rhode Island State House. We'll be back downtown in the Navigant Credit Union Broadcast Center at 4. We look forward to seeing you.
Thank you.